Thank you for this opportunity to be part of such a unique event. I'm going to share with you a story of our 7-year experience with a model of care that is making a difference for patients. And as Andre said, I work at the Sunnybrook Holland Orthopedic and Arthritic Centre, which is in downtown Toronto, and we're the largest joint replacement centre in Canada, and we have about an annual volume of 2,100 procedures. So I wanted to say that 7 years ago, we realized that we weren't doing such a great job. We started conducting focus groups with our patients and our healthcare providers, and we learned a lot of interesting discoveries. I want you to look at this figure on the slide, and you'll see that at every point of the patient's journey, there were problems. If we start with the referral, we found that patients didn't even know where their referral was in the queue. When patients waited to see the surgeon, if they did see the surgeon, it was a long wait. When they were face-to-face with the surgeon, they didn't have time to even ask their questions or talk about treatment options. And then if they were proceeding to surgery, furthermore, they had a longer wait. So, and what we found is even post-operatively, these patients were having the same experiences. So when you look at the far column in the post-operative follow-up, our surgeons were burdened. They couldn't even keep up with the follow-up. There was no capacity for new patients. So as we've heard from other speakers this morning, there was no point in doing more of the same. We had to make significant change. So we started with a total overhaul of our outpatient services and with new benchmarks and new targets. And I want to highlight the actual key elements of our model because these are key principles that could be transferred to any model of care. So because our surgeons were burdened, we wanted to introduce a team-based approach to care. It was critical that we'd have central intake with an electronic referral management system because the patients were having to make too many calls to even figure out where they were in the system. There was an emphasis on patient choice and empowerment. We wanted to have selective referral to the surgeons. We developed a number of algorithms to support, so it was driven by criteria when they went on to the surgeon. Post-operatively, we wanted to ensure again that it was a team-based approach to increase capacity in the system downstream. And finally, it was critical to us to develop new community partnerships, particularly for us with the Arthritis Society, the YMCA, to promote healthy, active living for our patients. And so to do this, we introduced a new role and of advanced practice physiotherapists now seeing these patients. And you might ask why. Well, in the literature, it clearly has been shown that physiotherapists share a common orthopedic foundation, and they achieve similar skills to orthopedic surgeons in terms of assessment and diagnostics. And the literature is throughout the world in terms of, it's been in England, we've seen it in Scotland, and Ireland, and the US, and in Canada as well. So to achieve this change in introducing a new provider role, we had to have a change management system. We use this 9-step framework, and due to the time restraints, I won't go through the steps, but I want to emphasize the importance. We all talk about using change management strategies, but we've seen a number of sites that try to skip steps and introduce change too quickly and not have success. Key to our success was having orthopedic surgeon collaboration and buy-in from the outset. Now, I want you to look at this slide because this is how we've remapped our whole model of care. And you'll see when the physician's referral comes into central intake, I'm going to refer to our advanced practice physiotherapists as APPs for ease. The APPs triage all referrals within 2 business days. And now we've introduced an assessment center. In the assessment center, the APP provides an initial comprehensive assessment. For those patients who no longer need a surgical pathway, they actually get a treatment planned with community resources, and the feedback has been very positive. In terms of those patients who go on to surgery, the APP provides the long-term follow-up, and they also provide faster access. We have a telephone support system now so that if a patient has a problem, where before it was so difficult to get past the surgeon's office to even talk to the surgeon, now that they can speak to the advanced practice physio who does a comprehensive telephone screen. If there's issues, they're brought into clinic right away. So patients can access telephone support in clinics when they need it. In terms of our results, you can see, central intake, now we have about 250 referrals a month. We have introduced electronic tracking. We have Weight One reporting capabilities, and Weight One, for those of you who aren't familiar with it, is from referral to point of consultation with the surgeon. And we're well within our provincial ministry targets. In terms of the assessment center, we're seeing about 230 visits of patients a month. And what's really impressive is since 2007, that's over 12,000 visits. In terms of the surgical process, the APPs are involved much earlier in the education of the patients, and so we're seeing an impact on our length of stay in terms of patients being comfortable, more satisfied, less anxious about the whole surgical process. We have less cancellations because now when patients are seen in the assessment center, if they're on the surgical stream, they also see a pre-admission nurse who optimizes their health, so we're having less cancellations. So I hope you've heard that. In terms of the patient experience, there are many benefits, and this slide just summarizes that. In terms of the intake assessment, we have patients getting individualized recommendations, comprehensive assessments. In some cases, patients were getting surgery before that truly, because they hadn't had a full assessment, really didn't need surgery. We have choice of surgeon. Patients have time to ask their questions. They can discuss treatment options. If they're not ready, even though they may be a surgical candidate, there's re-entry options. Our decisions are based on standardized outcome measures. And in terms of the assessment side and the post-op follow-up side, we're seeing that patients are just delighted with the increased access. Again, physiotherapists have the added value of being able to maximize function. So they're seeing the advanced practice physiotherapist at a time when they want to optimize their recovery. There's more opportunity for monitoring and tracking. So overall, we've seen huge benefits to the system. And in terms, I wanted to have you hear what our patients are saying. I've put a few links, and I'd encourage you, because for the purposes of this presentation, I have one patient's testimony that I've chopped down so that you could hear it. But I'd encourage you to listen to the CBC. Recently, Dr. Brian Goldman with White Coat Black Art did a segment on our advanced practice physiotherapists, and I think you would find it very encouraging. So I'm just wondering, I don't have a mouse up here. If to click on the link, I know because it's important. I want you to be able to hear it. Okay, good. Thank you.
It was a very comfortable and very informative type of procedure. She allowed me to see the x-ray. She explained exactly where my problem was, and the fact that I still had lots of life left in the knee, so that I didn't necessarily have to go the way of surgery at present time, which was very comforting because I was able to see it for myself instead of just trusting the words of others. I was able to ask questions, get answers, and I was really impressed with her recommendations at the conclusion of the whole experience, and I followed up on a number of those already. When I left there, I couldn't wait to tell other people about what a great experience I had. I think it's a very wise use of the healthcare system, and I really think that it's progressive based on the fact that knowledge is power, and consequently the power in this is that the patient gets to feel that they're in control of their decisions.
Thank you.